agrees with me, and we both say, look, if you never have suffer or you never have pain, how will you know when it's good? How will you know when it's great? So all the suffering's not for naught. It's not for no reason. It's not. Well, that's a double negative. English majors, and you know who you are. I just made it owie. Um, and I'd like to also do a book on my physician's struggle as a normal person, and explain to some people why they get doctors that they don't get or they don't understand, or maybe they feel like they're not right for them. And how do you choose a doctor? Why is that important? Because it is so important. If you don't tell your doctor what you need, you're never gonna it's never gonna work for you. What's the point? If you went to the car dealership or to your auto guy who fixes your car and said, "Fix my car," and walked out the door, how in the world would he know what to fix? That there's a special noise, or there's this odor, or you know, there's this thing going on. How would he know? You've got to give him information. I've had too many patients where I've struggled diagnosing this and that and trying to find an answer when I find out, oh, I drink a fifth of vodka a day. Really? I did not know. And that might have saved thousands of dollars in a workup. But I get it. I get it. It's embarrassing. It is against what society says. So how could it happen to me? And I'm not like all those other people. It doesn't matter either way, but if you want your physician, if you want your dollar to matter and your time with your doctor to matter, you've got to be honest. And if you can't, then you need to get a different doctor, or a dentist, or specialist, or a priest, or a minister, or counselor. We have to trust and have faith in these people. And if we don't, I'm not saying don't go, but I'm just saying, if you read a review on a product to help you with weight loss, and the reviews are like, sucks, or if the reviews for Rotten Tomatoes on a movie go, we're going to give it a 5%, Rotten Tomatoes, and you're like, well, I'm not going to that movie. So, I mean, why would you believe people that review a movie? You don't even know them. My best advice for myself is to get my pituiter to the doctor, because I don't do it enough. Any other ideas or things you want me to do ebooks on, let me know. They're all going to, I don't know about pricing, because they have to be priced at something, probably $1 or $2, I don't know. And they're not meant to replace going to your doctor. They're not meant to replace talking to your doctor. They're not meant to replace the American Academy of Family Practice, the American Medical Association, the New England Journal of Medicine. They're meant to get you to think about what it is. They're maybe meant to provoke a question that you can ask your doctor. They're to give some insight. But they're really meant so that you have a resource of someone you know, or maybe someone you want to know, so that you can understand something. And I'm going to try and do it in human speak. Because too many times people come back and go, the doctor speak in Chinese, and when he was really speaking doctor speak, and I don't get it. I don't understand. And people go to the specialist, come back to me, and they'll say, I think he said I'm okay. And I'm like, what? What do you mean he said he was okay? What'd they do? Where'd you go? What x-rays did you have? What tests did you do? And they're like, I'm like, it's your test. It's your information. You need to know. Like, let me tell you, for example, I have a patient, I shouldn't say this. I've had patients who found out later that someone in their family was diagnosed with melanoma, which is a skin cancer. That's a really important piece of information. And they didn't find out for who knows why. But I didn't know. If I would have known, I would have said, okay, we're going to do, every 6 months, we're going to look all over your body for weird looking moles, or send you to dermatology, or do whatever. But that's the kind of history that I need to know. Mom, dad, aunt, uncle all have diabetes. You betcha I'm going to start checking blood sugars and diabetes testing as soon as I can, and give you advice on how to not to become a diabetic, only if I know. So bottom line is, to the end of this video, I'm going to be doing ebooks. I would like to know what you want me to do. I'll let you know if it's going to be Amazon or Apple. It would be very helpful for my time if we got the word out to family, not just in Montana, but all across the country. It's just going to take time, and yeah, and I'm going to retire at 52. Yeah, right. No, I just want to make sure that I don't know if Amazon and these places will allow